So let's talk about the decompression sickness, right? Guys, now let's talk about the decompression. So you might have heard about this term, decompression sickness. Decompression means against the compression, right? Usually it is seen in the divers, right? The decompression sickness, it is also called as, guys, it is also called as Casson disease, right? So do not confuse yourself. It is also called as a Casson disease. And decompression sickness, guys, it is most commonly seen in deep sea divers. Okay, deep sea divers, because what happens generally is that they will be actually going deep inside the sea, right? At that point of time, there will be the compression over the body. You know, if you will be going to more depth of the sea, obviously the pressure will be increasing, and if the pressure will be increasing, it is actually they are exerting the pressure on the body. If they're exerting the pressure on the body, usually, if you'll be seeing the divers basically in the movies or in the television, basically, okay, you must have seen that maybe in the Discovery Channel or something somewhere else in the movies and all. So what you will see that they will be having the cylinders, right, on the back. So they are having the nitrogen cylinders, and they will be having the special chute, right? Because generally you can't go that much deep in the sea like that only, right? So basically, if they will be going in the deep sea, right, then what will happen? The compression will be increasing over the body. And then if they will be suddenly ascend over to the sea surface, right, suddenly from the deep sea, now they want to ascend upward on the deep sea surface of the sea. Now the decompression will start happening. And due to the decompression, what will happen? The solubility of gases will be increasing rapidly. So here at this point of time, solubility of gases will be increasing, and if the solubility of gases will be increasing, the pressure will be increasing. Actually, I can say that solubility of the gases is actually directly proportional to the pressure exerted, right? It is directly proportional to the pressure, solubility of gases. So here what happens is, due to that, rapid ascent from the deep sea towards the sea surface, right? Rapid ascent from the deep sea, right? What I'm talking about is, for example, this is the sea surface over here, and here there was a diver who was actually present in the sea, right? Actually present in the sea, and he was actually floating around. Right? Isn't it? There might be some beautiful fishes and all, right? Okay, let's say these are the fishes and all. So what will happen now? This person decided that I will be going upward now. I will be going upward on the sea surface. So he wants to come at this level. He wants to come at this level now. What might happen? Due to this process, in this particular process, right, guys, decompression will be happening. If he will be deciding that to go upward, right, suddenly, right, in no time or in very less time, he wants to go upward, right? So in that manner, decompression will be happening, and due to that, that's why we are calling that as Casson disease or the decompression disease over here. So basically, here the solubility of gas will be increasing. Due to that, the bubbles can be formed in the blood circulation in this particular person, right? What can happen, guys? There might be the development of the bubbles, right? So rapid ascent from the deep sea will be causing the nitrogen dissolved in the blood and will be causing the formation of the bubble, right? So over here we shall write, right? So rapid ascent from deep sea, it actually might lead to, or it actually might cause basically nitrogen dissolution. So nitrogen might be getting dissolved in the blood, which will be leading to the bubbles formation, over there, right? And now we are having two types basically. If you talk about Casson disease or the decompression sickness, right, we are having the two types. In the type 1, guys, we are talking about the milder forms only, right? And the bubbles might be formed in the joints, right? So joints might be involved, joints involvement might be there. And here we are talking about that this is the milder form of the decompression sickness, right? In this form, edema might be seen in the persons over the body because the bubbles are actually formed over there. In the type 2 form, this is the severe form, guys. In the type 2, this is the severe form, and here cardiovascular system might be involved. And here this is the severe form. Of the decompression sickness. Some more points over here, because I'm talking about the formation of bubbles inside the body over here, bubbles inside the blood circulation over here. What could be the treatment? Treatment could be the hyperbaric oxygen, of course, but over here they can be prevented by the slow ascent. I told you that faster ascent, rapid ascent up to from the deep sea to the sea surface, it will be causing the decompression. So what you can do, it can be easily prevented by the slow ascent, right? At that point, then if they will be doing like that, then obviously the symptoms will be much lesser, right? Second point over here is, the nitrogen bubbles. They will be having they might cause different problems according to the body organs they are affected. For an example, let me take the example over here as well, right? For an example, if the nitrogen bubbles are getting, accumulating inside the lungs over there, it might be causing the choking, it might be causing the dyspnea, right? So nitrogen bubbles, right, they might cause choking, dyspnea, if I'm talking about the lungs. So obviously the person will be having, breathing problem, breathing issues. Second point, if they're affecting the sinuses, it might be causing the barosinusitis. Let's say if it is affecting the joints, then we are calling that as bends. If it is affecting the, causing the irritation in the nerves, then it will be called as prickles. These are some fancy words which they have named over here. If it is causing the problems in the, intestinal loops, then we are seeing that abdominal distension might be happening, right? So all of these things are actually causing nitrogen bubbles. The nitrogen bubble formation basically will be happening. Slow ascent is the solution which we can take over here. Okay, so what could be the treatment part? Treatment part will be very simple, that we should be telling the patient that slow ascent is very important in these cases, and that's how they are getting training as well. And after that, we shall be actually talking about the hyperbaric oxygen support. Okay, so hyperbaric oxygen will be giving over here, right, so that we can actually save this person, right? So basically this is the thing in the decompression sickness. Okay, in a nutshell, we are saying that in this particular case, we are talking about the nitrogen bubbles. Rapid ascent will be causing the nitrogen bubble formation inside the body, and if they will be affecting the different organs, different kinds of problems might be seen. For example, barosinusitis might be seen, choking might be seen if it is causing the problems in the lungs. If it is causing the problem in the joints, okay, joint bubbles can be seen, though we are calling that as bands. If it is causing the nerve irritation, we are calling that as a prickle, right? So these different names has been given as well. Now we shall talk about one more important topic, guys, that is the acute mountain sickness, right? Acute mountain sickness. So let's talk about now acute mountain sickness, what it is. Basically, it will be seen in what? Climbers. So it will be seen in the mountain climbers, or you are going to the mountain climbers, or you are going to the high altitude, mountain climbers or high altitudes. Obviously, right? As the name suggests, there is the mountain sickness. So what will happen at that point of time if the person is actually reaching, what is the criteria? More than 2500 meter without acclimatization. What is the term acclimatization means? Acclimatization means, whenever we are actually ascending towards the high altitudes, right? Because we are not getting, we are not getting a habit of, reaching that particular thing over there, or reaching the high altitudes daily and all. We are actually going, we might be going for some religious purpose, or we might be going for some, trekking purpose, or all of these things. So what we need to do over here, what we need to understand over here, that we always should remember that whenever we are actually ascending over the high altitude, we should be slow. And that process is called as acclimatization. You can't actually ascend the 2000 meter, 2005 meters in just 30 minutes, right? Or you just went with the chopper, you just sit into the chopper, and chopper just left you over that particular mountain surface, right? At that point of time, you'll be having so many kind of problems, because your body physiology will be changing in such a manner that, they will be trying to accommodate to that particular colder climate. And in order to do that, they will be having some kind of problems in the body, and those kind of problems we're going to talk about in this particular session. So acute mountain sickness, guys, if the person will be reaching more than 2500 meters without acclimatization, it can cause several kind of problems in the body. That's why the army soldiers are also trained in such a manner so that they are getting acclimatized. So what they are doing basically, if they are actually ascending some kind of mountain and all, they will be ascending the mountain, they will be resting for some period of time, right? And then they will be ascending some distance, then they will be resting for some period of time, then again they will be ascending, so that they are doing the acclimatization. So that's how the training of the army soldiers as well is happening, right? Otherwise, if they will be, ascending that much big mountain in a day or two, then obviously they will be having these kind of problems, right? Because after all, this is the body physiology and you can't actually fight with that. Obviously, with some training, you can be actually improving those kind of things. But, after all, we need to respect these kind of threshold of the physiology of the body, right? Okay. Once you have talked about that, it can cause two important problems. One is the HAPE, that is the high altitude pulmonary edema. The person will be having, a dyspnea problem, breathing problem, and all of these things. The person will be having the alkalosis. What is the pathophysiology behind causing all of these things? It is very, very simple, guys. You must have heard about this. You must have talked about this in the acid-base imbalance also, right? So it's very, 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 very easy, guys. Look over here. For example, you went to the high altitude. Once you have reached the high altitude, what will happen? Obviously, you will be lacking the oxygen in the air, right? So there will be there will be hypoxia. So you will be lacking the oxygen. Now your body, what will do? Your body wants more and more oxygen. So what will you do? What will you do, guys? You will be doing the hyperventilation. Because you will be doing the hyperventilation, now what will happen? More and more amount of oxygen you will be inhaling, more and more amount of carbon dioxide you will be exhaling at the same time, right? Once you will be doing that, now what will happen? You are washing out your carbon dioxide from the lungs, or you are washing out from your carbon dioxide from the blood as well. So in that case, because you are washing out the carbon dioxide levels will be coming down. And we know that this is a body physiology. There is an equilibrium between the CO2 levels and the HCO3 levels. So there is an equilibrium between the carbon dioxide levels and the bicarb levels. So what will happen? You are actually exhaling out more and more amount of CO2. So CO2 washout is happening. If the CO2 washout is happening, CO2 is getting lower and bicarb is still high in your blood circulation. So in that manner, it can cause what? It will be causing the alkalosis. Because you are using the lungs in this process, it will be causing the respiratory alkalosis. I'm not going into much detail. This is the acid-base imbalance concept. Okay, some of you who have read it earlier, okay, you might be able to catch it what I'm saying right now. So this is the problem which is happening in the higher altitudes. So that's why respiratory alkalosis classical example can be the high altitudes, right? I hope you got the idea over here. Once again, I'm just repeating because I'm writing right now. So over here, guys, what I'm writing over here is that, whenever you are reaching up to the high altitude, you reached up to the high altitude, due to that, you will be lacking the oxygen. Due to the lack of the oxygen, because you will be lacking the oxygen, what you will do? You will hyperventilate. Because you will be doing the hyperventilation, you will be doing the carbon dioxide washout. Because CO2 will be coming out from your body, from your lungs, CO2 washout. Due to the CO2 washout, what will happen? You will be landing up in the alkalosis. That is the process. That's how these kind of person might be developing the alkalosis. Two important diseases two important problems these people might be facing. One is the HAPE. HAPE will be the high altitude pulmonary edema, guys. High altitude pulmonary edema. In the high altitude pulmonary edema, as the name suggests over here, because the high altitude, because you reached up to the high altitude, pulmonary means lungs, edema means excess amount of fluid will be accumulating in the lungs, right? Excess amount of fluid accumulation is the edema. So edema in the lungs, basically, that will be happening. Why is it happening? Because suddenly the person went up to that particular climate, cold climate, and that will be causing this. Why it is happening? Let me talk about that as well. In these kind of cases, in the HAPE, high altitude pulmonary edema, there obviously, that there is a hypoxia. The level of oxygen is comparatively lower as compared to the sea surface. Obviously, so you are on the high altitude. So amount of oxygen, because it is lower, now because of that, what will happen? There is a vasoconstriction, VC. There is a vasoconstriction in the pulmonary capillaries. Due to the vasoconstriction in pulmonary capillaries, what will happen? You will be having the problem. You are in a big problem now. That is hypoxia. You will be lacking. Already the oxygen is very less. You are having the vasoconstriction as a compensation. So now what will happen? Again, alkalosis will be happening. Again, you will be hyperventilating and alkalosis will be happening. This is a vicious cycle, guys. And obviously the pulmonary vasoconstriction will be happening over there. And that's why, the fluid accumulation will be happening inside the lungs and all. So that's why pulmonary edema will be seen over there. One more problem it might cause, that is the HACE. What is the HACE, guys? Over here we are talking about the high altitude cerebral edema. This is more severe problem, right? This is more severe problem. So for a very long period of time, you are starting having the symptoms and still you are on the height only, right? There is no way that you can reach downwards. So at that point of time, the person might be developing the HACE also, high altitude cerebral edema. That's why we, climbing the mountain is not a joke, right? Climbing the mountain is not a joke. Climbing the Mount Everest is not a joke. That's why there are very few people who have successfully reached the peak of the Mount Everest as well, because there are so many people who are actually attempting it, right? But this is not a joke. So many of the things are actually happening inside the body, okay, and that's why the people might be developing the high altitude pulmonary edema, the people might be developing the high altitude cerebral edema, and that's why they have to actually come back to the sea surface, right? So these are the things actually which is not allowing our body to actually going to that much height, right? So once you have talked about this, in the HACE, high altitude cerebral edema, again guys, because of hypoxia, what will happen in the brain, right, due to the hypoxia, right, for a very long period of time, in the brain, vasodilation will be happening. VD means vasodilation, VC means vasoconstriction. In the brain, vasodilation will be happening. Due to the vasodilation, there will be the cerebral edema. Understood? So that will be the thing which will be happening in the acute mountain sickness. And one more thing guys, HAPE can cause HACE, and at the same time HACE can cause HAPE as well, right? So these two terms are interchangeable. Okay, one thing can cause another and another thing can cause another. Okay, depends on people to people over here. How will you be treating this patient? Obviously the ascent, if you are doing, acclimatization is very important. So that is you are reaching up to the height, acclimatization, do the slow ascent, right? Slowly we should be ascending the mountain, right? As we are building our preparation also very slowly, right? In one day or in a week you can't be getting prepared for the big exam, right? In one day you can't prepare for the FMGE exam. Obviously you will be needing the time, right? So daily, if you are studying with the consistency and all of these things, that will be building up your preparation, and finally you will be ready for that, right? So anything which we are doing, right, it should be happening gradually, right? So that we are getting the better results. So over here also guys, as far as treatment is concerned, very simple, as everybody can understand that slow ascent is the treatment over here. With that, 100% O2 support will be given to these patients because they will be having a severe dyspnea, right? So that's the problem over here. Along with that, acid base imbalance will be there, so electrolyte should be balanced, right? Now we shall talk about one more term over here that is important for the MCQ's point of view. What is the sickness absenteeism? Okay, what is the sickness absenteeism? Sickness absenteeism, it is a very sensational indicator, or I will say it is a very sensitive indicator for the occupational health diseases. So it is what? It is a sensitive indicator guys. It is a sensitive indicator for occupational health workers. Okay, that will be the better term, occupational health workers, right? It is having actually a formula over here. What formula? It is actually having a formula of total number of worker days absent by total number of worker days multiplied by 100. Okay, so if you are having a 30 days in a month, right, out of 30 days, let's say you are present in the 25 days, 5 days you got the leave, right, divided by total number of working days, out of the working days, let's say 25 working days were there in a 1 week, and out of those 25 working days you were present in only 20 days. So out of 25 there is a 20 days, so how much multiplied by 100, whatever will be the value, that will be showing the sickness absenteeism, right? So it is actually sensitive indicator for the occupational health workers, right? It is actually inversely proportional to the occupational health of the worker, right? If the sickness absenteeism is very high, occupational health of the person is very low. If the sickness absenteeism is low, occupational health will be high, right? If you are if you are managing one company, let's say, and you are the CEO of that company, right? What will be good for your point of view, in terms of your point of view? If the sickness absenteeism will be very high, then you should be happy. If the sickness absenteeism will be low, right, then you will not be a good person over there, because at that point of time it is good for the occupational health, it is good for the workers, health of the workers, but not good for your business, right? So that is the basic thing. Sickness absenteeism is actually inversely proportional to, so I'm writing over here SA means I'm just denoting the sickness absenteeism, and it is actually inversely proportional to the occupational health of workers, right? Occupational health of workers, right? Understood? So that is about the sickness absenteeism. Okay, the last term which I want to mention over here, that is the periodic medical examinations, because very commonly they're asking you that how commonly or how often you will be checking the health status of this person if he is working in this particular area or in this particular occupational job, right? So periodical medical examination needs to be done, right? In some places it needs to be done monthly basis, in some places it needs to be done on an annual basis, in some places it needs to be done every time or daily basis, right? So let's talk about those criteria also. Let's say first one, that monthly checkups. In what occupation the monthly checkups are very important, right? Monthly checkups are very important. So for an example, when you were working in the when we were working in the COVID wards, right? Every day what they were doing the rat test, right? Rapid antigen test, so that if you are exposed or if you are coming positive or not, right? So that was the thing over here. So monthly checkup has to be done for the lead, dye, the persons who are working in what kind of industries. For example, in the lead industry or the dye industry or the radium industry or the chemical industries, right? Heavy chemical industries. In these industries it is needed, monthly checkups are needed, right? In these industries monthly checkups are needed. And if we talk about the daily checkup, the daily checkups are needed in the dichromate industries, right? So that was the MCQ once they have asked us that daily checkups, if we talk about in what industry, so it is the dichromate industry. Dichromate industry, they need the daily checkups. Okay, so this is also the important point which we need to remember. And the third point is the event based. This is the event based type. Event based type. For an example, a pilot has to fly the plane. If the pilot has to fly the plane, obviously he should not be drunk, he or she should not be drunk, okay, and they should be having the proper sleep, right? So these kind of things should be there. So for that purpose they might be having the test for those, right? So for example, the pre-flight medical checkups might be done for the pilots and all, for the crew members or cabin crew members and all, right? So over here we shall write that pre-flight checkup for an example. Other kind of examples might also be there. For example, I gave you the example of before leaving home for the COVID, they might be checking for the rat test, so that if you are already having the COVID, then you should not be serving the COVID people because you already have the COVID. Okay, so first the health of yours should be coming, right? And if you are healthy, then obviously you will be able to serve more people. So pre-flight medical checkups might be done. Okay, that will be the example of event based, right? Now let's have some chunk of MCQs, guys. Okay, and let's try to solve some of the MCQs so that we feel more confident, right, about this particular topic. So guys, first question they asked us, asbestosis is associated with which cancer? I know all of you guys are actually answering me, and that is yes, it was causing the peribronchial fibrosis. So this is a bronchial carcinoma, right? So it is a lung carcinoma which they were causing, so that should be the answer, right? Now let's move on to the second one, guys. Mesothelioma. I don't think you should be having any kind of problem regarding this question as well. Mesothelioma is seen in which type of pneumoconiosis, guys? Yes, that is is it silicosis? No, it is not silicosis. It was asbestosis. Asbestosis. So that is the answer over here. Next question, guys. They asked us, Byssinosis is the name given to the occupational disease of lung caused by inhalation of what? What is the disease? Byssinosis. Byssinosis. Bag mein cotton. Bag mein not cotton. Bag mein sugarcane, right? So in the bag there is sugarcane dust, right? Bagasse fungus over here, Thermoactinomyces sacchari, right? Yeah. So it was the sugarcane dust. So that will be the answer over here, right? So sugarcane dust should be the answer in this case. Next question, they said that all are false about the lead poisoning except. So in the lead poisoning, we know that so many kind of symptoms we have talked about and all of these things. So let's talk about them. So corpus of fire in urine levels more than 100 mcg per liter indicates exposure to lead. Greatest exposure is drinking water from lead pipes. No, drinking water from lead pipes doesn't cause the lead toxicity as such. Then stripling of the basophils is a significant finding. It is a significant finding. I would say that was the finding, but not a very significant one. Other findings are also there with that. Then can cause blue lines on the gums. Yes, it was causing the Bartonian lines. It was causing the Bartonian lines on the gums. So it is kind of a true statement over here. So this should be the answer. This should be the more appropriate answer, I would say, right? Now, fifth one of the following symptoms is not caused by the inorganic lead poisoning, right? If you talk about the inorganic lead poisoning, then anemia, yes, it might be seen. Pallor, facial pallor might be seen. Right? Bartonian lines, yes, Bartonian lines can be seen. Bartonian lines basically, blue lines on the gums. These are the blue lines on the gums. With that, basophilic stripling was also seen, right? But insomnia I haven't mentioned about anywhere in the lead poisoning topic. So insomnia should be the answer over here in this case, because they have asked you not caused by lead poisoning. Okay. Next question at last we are having, that is nausea is there, vomiting is there, blue line on the gum, there is a Burtonian lines, and wrist and foot drops. I know you are telling me the answer, this is the plumbism, or this is the saturnism, or it is the lead toxicity. With that, pallor was also there, colic was also there. Our manifestation of poisoning due to what? It is the lead. But is it organic or is it inorganic? These are the inorganic. Whatever symptoms I told you guys, usually they are inorganic symptoms. Organic symptom they are not going to ask you. For example, if you talk about the insomnia, that was the organic symptom. That was the organic symptom. And here they have asked us the inorganic symptom. Organic symptom they will not be asking you generally, but whatever symptoms I told you, anemia, Burtonian lines, basophilic stripling, then the colic pains or constipation, then the foot drop or the wrist drop, then the facial pallor, hemodynamic changes, hormonal changes, right? All of these features will be the inorganic dust poisoning. Other than that, if the features are coming, that might be the organic. Okay guys, so here the answer would be what? Answer would be the inorganic lead poisoning, right? So I hope you got some value out of it, this particular topic, right? And we have touched upon many important topics over here, occupational health diseases, right? Very, very important guys. 1 or 2 questions might be expected in your exam. Very, very frequently asked topic, because it is covered in other subjects also. So you will be having that particular confidence in yourself. Just one time revision will be enough for this particular topic. Go through that and let's move on to the next one, right? Thank you.